Hello, I'm Dr. Paul Homoly. I'm looking forward to coming to your area and presenting my program, Case Acceptance for Everyday Dentistry. It was a few months ago, and I'm sitting in listening to a young dentist present care to his nervous patient. She had her 2 young children off to the side in the operatory. He finished the exam, put the mirror back on the bracket table. He pulled his mask off, cupped it over his chin. While the patient was still in the reclining position, he looked at the x-ray monitor and started to talk to the monitor. Eventually he said to the patient, "You need 7 root canals and crowns." Well, he went on to say how he's going to access the pulp chamber and enlarge the canals and prep the teeth. Well, you get the picture. Well, listening to this dentist, I could tell that he knew what the patient's needs were. What he didn't know is that when he left the operatory, this patient broke down in tears. It was easily the worst example of case presentation I had seen in the 25 years I've been teaching dentists. You know, and during that period of time, I've seen marvelous examples of dentists and team members present dentistry in a way that patients are happy and they're eager to accept care. The big differences between the best and worst dentists and team members relative to case acceptance success is their point of view. It has very little to do with their clinical skill. It's all about the point of view. See, the dentists who are the worst at case presentation are the ones who see it as a technical presentation. They say things like, "Well, Mrs. Smith, you need 7 root canals, and here's how we're going to do it, and here's step 1, step 2, and step 3. Or the dentist and team member see it as a sales presentation. It's even worse. They say, "Well, you need 7 root canals, and you need 7 crowns, and if you don't go ahead and do this right away, it's only going to get worse and be more expensive. And is there any reason why you can't go ahead with treatment today?" Now, the dentists and team members who are the most successful with case acceptance are the ones who see it as a leadership presentation. That's the focus of my presentation. It's how do we lead, not sell patients into care. Now, here's what you're going to learn. You're going to learn the 4 essential conversations that you'll need to have with every patient so you can influence them to make good dental health care decisions, and while you'll never feel like a salesperson. I'm going to teach you how to discover a patient's budget before you recommend care. That way, you don't blow them out of the water with this huge fee they're not ready for. I'm going to show you how to keep patients in your practice who are not yet ready for care. I'm talking about the big cases now, the $8,000, $10,000, $12,000, $15,000 case. Those cases where the patient can't do it all at once. How do you keep them in your practice so when they become ready for care, they'll choose you? I'm going to teach you how to talk about money so you're comfortable, your team members are comfortable, and your patients are comfortable. Now, here's a good way to prepare for this program. Go to my website. It's www.paulhomoly.com. In it, you'll find an 18-minute video called Case Acceptance for Everyday Dentistry. Watch it. It will give you some good ideas. And if you can, bring your team. This is a great team program. They'll help you take the principles and put them to work in your practice. Case Acceptance for Everyday Dentistry. I'm looking forward to being with you.